Hello everyone, I'm Nunung Nurul Komaria. I would like to present my paper which titled NLP Analysis of COVID-19 Radiology Reports in Indonesian using IndoBERT. My name is Nunung Nurul Komaria from Bina Nusantara University, Indonesia, with my colleague Tianda Sun and Dimitar Kazakov from University of York, UK. Okay, so this is the outline that I'm going to present in my presentation. Start from the background and then literature review, methodology, result and analysis, and conclusion. Okay, let's start with the background. We know that the world has gradually begun to recover from the pandemic caused by COVID-19. COVID-19 itself can be detected from radiology images, such as chest X-rays and computed tomography scans. Interpreting CXR and CT images requires special skills. In the context of COVID-19, this task is usually performed by both pulmonologists and radiologists. All patients' history is stored digitally in the form of an electronic health record. Improving patient care through high-quality documentations, including Radiology Report, is quite mandatory. Specialized strategies and techniques are needed to perform efficient analysis and automated information extraction and its efficient analysis. So this is how the radiologist reports looks like. There is radiology image, which can then translate it into a report produced by the radiologist in the form of text, free text like this. Not every doctor can produce the reports like this. So in this paper, we would like to analyze the kind of report that produced by the radiologist in Bahasa. We perform some literature review and find similar ideas with our paper. Actually, it's quite recent. We first found that Pons et al. Identified 67 papers published between 1993 and October 2014 mentioned 5 application categories. First, diagnostic surveillance. Second, cohort building for epidemiological studies. 3, query-based case retrieval. 4, quality assessment of radiology practice. And 5, clinical support services. And then the next literature from Curry et al. Analyzed 450,114 chest CT report collected in the period 1st of January until 3rd of October 2020. And NLP here was used to build regression style models in order to predict the number of confirmed COVID-19 case in the US. They achieve a coefficient of determination R² is as high as 0.82 for daily COVID-19 cases, which went up to 0.90 when weekly data was used. And then the third literature found published by Lopez Ubeda et al. Automated COVID-19 detection with NLP in radiology text report. They used 295 radiology reports from chest CT scans to perform text classification and found that the best model for this task is SVM, support vector machine, with a baseline accuracy as high as 0.85. And then another similar work by Jungmann et al. Published in 2022, it's quite recent, used NLP to study the effect of COVID-19 on the number and type of fractures among patients of different ages. They collected 5,000 397 German language radiology report, consisting of hand or wrist, elbow, shoulder, ankle, knee, and pelvis. The data were collected from March to April in 2015 until 2020. Then they classify using NLP into two classes: fracture confirmed and fracture not confirmed. They achieve an F1 score of 0.81. We're going to explain the methodology that we use in this paper. We collected radiology report from COVID-19 patients from the first wave of COVID-19 in Indonesia, spanning March to December 2020. The dataset is available from the electronic health record system provided by the Pasar Minggu Regional Hospital, Jakarta, Indonesia. Our dataset contains 1,789 reports written in Indonesian language or bahasa from 500 patients. Three attributes are most commonly populated in the datasets, like you can see in the table: patient ID, which is the patient ID, and then Hasilrat, which is the text, the radiology report, and then Pulang ID, which is the label. This represents the patient state with the following range of values: P01 to be discharged, P02 patient asked to leave hospital, P03 died after more than 48 hours, P04 died within 48 hours, P05 moved to another hospital, P06 continue COVID treatment, P07 continue non-COVID treatment. And then this is the NLP task that we perform in this research. First, we use the text encoder from IndoBERT model proposed by Koto et al. In 2020. As the text encoder and tokenizer, we use IndoBERT base P2. While with the clustering, we applied clustering to the sequence vector with IndoBERT encoder. We use the BERT topic model to initialize the clustering. And then for the text classification task, we use two assumptions. First, with the assumption that IndoBERT may need further pre-training on a medical corpus, we select the medical dictionary Kamus Kedokteran Dorlan. And we also perform the text classification on the vanilla IndoBERT. Okay, about the IndoBERT. We use IndoBERT in this research. This BERT model is trained on the Indo4B Indonesian dataset collected from publicly available sources such as social media text, blogs, news, and websites. BERT, or bidirectional encoder representation from transformers, is a transformer-based technique for NLP first developed by Jacob Devlin and his colleague at Google and published in 2018. BERT is used to handle bidirectional representation of anonymized text in a way that the left and the right side of combine into a context in all sections. BERT makes use of a novel technique called mask LM or MLM. It randomly masks words in the sentence and then it tries to predict them. Mask LM randomly masks out 15% of the words in the input, replacing them with a mask token. Run the entire sequence through BERT attention-based encoder and then predict only the masked word based on the context provided by other non-masked words in the sequence. BERT relies on a transformer, the attention mechanism that learns contextual relationship between words in a text. It consists of token embeddings, sentence embedding, and transformer positional embedding. Token embeddings, a CLS token, is added to the input word token at the beginning of the first sentence, and a SEP token is inserted at the end of each sentence. And then they have sentence embedding, a marker indicating a sentence, or sentence B, sentence A, or sentence B is added to each token. This allows the encoder to distinguish between the sentence. And then they have positional embeddings. A positional embedding is added to each token to indicate the position in the sentence. The hardware that we use to train this model is high-performance computing cluster called Viking, managed by University of York, UK. And the evaluation technique that we use here is the classification measurement, measured in the terms of accuracy, F1 score, recall, and precision. Here is the result. With the clustering, we found the top 4 topics for radiology reports are air bronchogram, homogeneous, consolidation, and part or field where they found the features. And then the second topic is dilatation, hypertensive heart disease, waist or heart waist, embedded, and apex. The third topic, cardiomegaly, part or field, projection, trachea, and costoprenicus or angulus costoprenicus. Topic number 4, trachea, angulus costoprenicus, line, regular, and narrow. And here is the result of the text classification. When we see here, when we train IndoBERT with Kamus Kedokteran Dorland, the accuracy is not different with the vanilla IndoBERT here. It's 0.93 versus 0.94, with the F1 score even lower, and also the recall and precision. So we are interested in this result as it may indicate that the vanilla IndoBERT model already has a good performance on text classification for our radiology report. Our pre-trained model or corpus may have a negative effect on the result. Okay, so now conclusion and future work. We were able to demonstrate the use of NLP to analyze radiology reports. The IndoBERT pre-trained model was used to perform text classification with the 5 labels representing the outcome for the patients. The result shows that we can classify the narrative text input very well, with the accuracy above 90%. Future work can involve more IndoBERT models to see which one is the best for this kind of dataset. Another possible research function to be considered is using the relation extraction method to build an Indonesian medical knowledge base for diagnosis support. Here is the reference that we use in this presentation. Okay, thank you for your attention, and you may ask me if you have any questions. Thank you, goodbye.